In 1998, Dr. Richard Klausner, then director of the National Cancer Institute, stated in an interview that the history of cancer research has been a history of curing cancer in the mouse. We have cured mice of cancer for decades, and it simply didn't work in humans. So why do we continue to uphold animal testing as the gold standard, in spite of its ineffective and often dangerous results?
It's a delicate balance, especially for regulators, to say, you can't say animal models don't work, because that's the legal basis of registration, and that's what they've been doing. So we have to put it nicely and say, well, we just need to move towards more human-relevant approaches.
Now to a health alert. This is one targeting drugs used to treat common colds, including sinus infections and even bronchitis.
And some doctors are raising concerns about bad reactions to popular antibiotics.
Rats don't predict mice. Rats and mice don't predict humans. There's a realization by those that matter that animals are less and less useful.
Tens of millions of animals across the country are used each year for medical research, chemical testing, and education.
For new discoveries to happen, we really have to discover them in a living system.
The work we're doing will save people around the world.
I think we have to be very humble about this right now, because we've often been so self-congratulatory, because we have, after all, many people feel made great strides. The numbers don't really support them.
Rats predict humans with about 43%. So tossing a coin is sometimes better than using these animal studies.
What is the NIH's policy about using animals for the research that you do?
Well, that's a good question. Animals are essential for many of the things we're trying to learn about how to prevent and treat human diseases, because we can't do things with human patients ethically, nor would we necessarily ask them to be involved in.
The Department of Agriculture's enforcement of even the minimal treatment requirements for animals who are subject to experimentation, including dogs, has been so lax and so permissive that there's no incentive for corporations even to abide by the law.
The protesters are probably on the same side as the people within the facility here. Everybody wants to no longer have to use the animals.
We have to find new approaches to biomedical research, and that is going to be very hard, because the animal research community wants to remain their status quo, like the way they have been doing things for decades.
We need to create a wholly different system, and I think we really need a paradigm change in that area.
It's not a matter of not happening yet, it's happened.
At Harvard, you'll no longer find a dedicated primate research facility. In fact, a growing team of scientists is developing technologies that could put an end to animal testing forever.
Cutting-edge technology is poised to revolutionize the way scientists test new drugs.
Researchers at Harvard University's Wyss Institute call it an organ on a chip.
What exactly is a lung on a chip?
Well, this is actually a lung on a chip.
Bioengineering has allowed researchers to construct microenvironments compatible with human cells, allowing them to function as they normally would inside the human body. Lung cells can breathe and respond to introduced bacteria. Gut cells can absorb experimental drugs, and heart cells can beat. Dr. Yu Shrike Zhang, a leading researcher of organ-on-a-chip technology, has ambitious visions for the future of medicine and patient care.
I think if you have these little chips that are more humanized, these devices can be eventually brought to the bedside, right? So you can start testing all the drugs or combinations of therapies on this kind of copy of the patient and then see which one actually works better for the patient.
Personalized medicine promises to open new doors, not only for future medications, but for our understanding of diseases themselves. Dr. Shushila Mahajan of Brigham Women's Hospital is using heart-on-a-chip technology to study the human heart in ways traditional animal models would have been unable to replicate.
As you know, the men and women are totally different in their physiology and their characteristics, how they respond to the drug, how they develop diseases. These characteristics are important to be considered when you treat the heart disease in men and women.
The transition to human model research marks a new era in medical advancement. It promises safer and more effective drug development and deeper scientific exploration of human health.
The research I've been trying to really work on has been ways to engineer functional tissues that can be used for healing those that are damaged in the human system.
It is cheaper than animals. It is very safe, biologically safe, and it is human alternatives.
It's more convincing people that they're really useful, right? So they're better than previous models, so that people can start kind of adapting to these new models than the previous kind of conventional models.
Evolving science and technology are ushering in a new era of biomedical research. But is the industry ready and willing to evolve with it?
Right now, it is not required by law to test any types of products on animals. So that means your household products, such as your laundry detergent, your floor cleaner, your window cleaner, makeup, sunscreen, hair conditioner, that type of stuff is not required either. However, many companies are still testing on animals.
They're force-fed commercial products like laundry detergent right into their stomach using oral gavage that cause them to vomit and go into seizures and comas. And even researchers say that most of the time these experiments produce little to no value because the physiology of dogs is so much different than that of humans.
California may soon become the first state to ban animal-tested cosmetic products. If there's a bill, it's moving through the legislature. If it's passed, it would make it illegal for any makeup manufacturer to sell products tested on animals in the state.
Now, cosmetic companies lobbied hard against the ban, claiming that alternative testing has not been perfected to guarantee consumer safety.
In any field so rooted in tradition, it's difficult to challenge the status quo. But that's exactly what companies like the Institute for In-vitro Sciences, just outside Washington, D.C., have been doing for decades.
So historically, almost all products, chemicals, pharmaceuticals, were tested in the living body, and the Latin phrase for that is in vivo. And here we're looking at cells and culture in the laboratory in glass, and that comes from the Latin phrase in vitro.
Certainly in the beginning, if we were trying to do things in non-animal methods, we were often accused of making traditional animal toxicologists look bad or trying to undermine their work. So it was a while before we were able to navigate through some almost the political difficulties that were involved until other people saw that what we were trying to do was do things in a better way.
Since its inception, the Institute has developed more than 35 toxicology assays, testing products for risks such as eye irritation, dermal sensitivity, as well as safety of new tobacco products. Products that not long ago were required to undergo mandatory testing on animals.
One of the big game changers in the field really occurred in 2007 when there was a report from the National Academy of Sciences talking about the future of toxicology testing. That we should be looking at human cells in culture, looking at effect on human cells and tissue and not in the whole animal anymore. So I always say since about 2007, alternatives were suddenly mainstream. However, one of the biggest hurdles is getting funding for research to develop new models because many of the NIH grants, the big grants, almost require some type of animal testing to be able to qualify for them. That's where we run up against the trouble of the animal being the gold standard. We're often being held to the standard of the animal model, which we have shown time and time again really isn't that reproducible.
In spite of the challenges, non-animal labs throughout the world are showing that the once thought gold standard of animal use is not that at all.
Although we're a relatively small organization, growing but still small, I'm happy that we're a place where good scientists can come to do this work.
I think harmful animal use, that's animal experiments and the dissection of purpose-killed animals in education, can really exclude some of the most critical thinking and emotionally and ethically literate students. So it's a real shame that poor practice within education ends up excluding some of the best people from the professions. So I think it's really important that students have access to innovative and humane methods, because these are some of the students you really want in your professions.
As alternative research gains momentum in mainstream science, young scientists are joining the ranks of those who already see that the animal model must and will be replaced.
So I actually came from the opposite side. I was a vivisector or experimenter in my past life. You know, like when you're a young kid and you're told that you're good at something, you kind of feel like it's your calling. I was told I was really good at dissecting animals and doing animal surgeries. So I was doing cardiovascular research using rats to see how high-fat diet would impact their contractility, how their heart functions. And we found out that when they have heart failure, their heart pump better under high-fat diet versus regular chow. And at the time, the lab took it as a novelty. You know, oh, this is so new, nobody's talking about it, we can publish it, let's figure out the mechanism. The PhD program requires 2 publications to graduate, and I was in the middle of writing my first publication. One of the reviewer asked, it's well known that rodents lack this protein called cholesterol ester transfer protein. So when they're on high-fat diet, their LDL doesn't shoot up, their HDL remains high, opposite to humans, because humans, we do have that protein. So does that mean that the finding is only limited to the model that you're using? I went digging and found out that, whoa, actually, this is a big deal. Because of that lack of protein, the response is completely opposite. And so the mechanism that I figured out, which was written into that paper, is very misleading because that's not what happened in humans. And I found out that there's a whole new world out there that talk about the limitation of animal models, the availability of alternatives, which you never hear during medical education. And I confronted my committee at the time. The response that I got actually similar to what you will hear, just regular people on the street. Well, this is what we've been always using, like we've been using it for so long, and there's scientific merit. The information that we gain from them will be useful to us somehow, someday in the future. The professors themselves don't even know much about the limitation of animal models. They didn't know that 95% of the time the animal tests do not predict human outcome. And they're in this ivory tower focusing on their own research, knowing nothing else but their own research. And they don't care about the translatability because all they care about is publication. So at the time, I had to make a very difficult decision, is whether I quit my PhD or I continue with it. It was torture for me. I'm not gonna get emotional now. Once you realize that you're actively killing something, not for the benefit of anything, that's not an easy one to kill. Before, I was totally for experimentation because I believed that was the way to go. After I learned the truth, the difference is night and day. You can no longer see them as just objects. I decided to continue based on one reason, and that is if I get my PhD, I will have a louder voice for the animals.
What if we have all been fed a false narrative about animal testing? What if instead we had a choice based on data, traditional animal use or advanced science? Don't we have a right to question the old way of doing things?
New tonight, thought-provoking billboards that put a big decision in your hands. The question is, who would you rather see live? They're paid for by the Foundation for Biomedical Research, promoting animal testing.
Will we challenge those who stand to profit from animal use?
We're seeing a shift away from the search for totally brand new discoveries that might pay off over the long term, and towards research that can have a genuine payoff in the next few years. For drugs that are actually much closer to being commercialized, because they want earnings per share and they want it now.
What would it look like to end animal testing today?
Charles River, the big sponsor of this meeting, is one of the largest animal companies there is. However, most of its revenue is generated from non-animal sources. So it's a changing world, and it's going to continue to change.
The organ on a chip has already won the Design of the Year award from the Design Museum in London, and it's on display at the MoMA in New York.
Still fighting animal testing!
Europe has taken an historic stand against animal testing, banning any cosmetics which use the practice.
We waste a lot of money on animal research that could be doing much better in other areas. Like if you redirect this money to, like for example, public health, to education about health.
Give me one or two examples, if you could, of something where you funded it and it became very helpful to the health of individuals.
Sure, and there's a long, long list of examples. Let's just take what's happened with heart disease. Heart disease death rates from heart attack are down by more than 70%. Why is that? Part of that is our funding something called the Framingham study in Massachusetts, which taught us what the risk factors are that you could actually interfere with.
In 1948, a group of 5,209 people in Framingham, Massachusetts, volunteered to take part in an epidemiological research study which followed their normal lives to uncover correlations to coronary heart disease. It is still being funded today. As it turns out, many of our most fundamental understandings of human health have come not from animal research, but by focusing research on finding practical answers to real human conditions.
Most people aren't trained at a master's or PhD level, so, these are scientists. He knows, of course he knows better than I will defer to him. But I think the public absolutely has to be involved, because if they really knew what goes on in laboratories and that no experiment is illegal. A lot of the comments that we get on our campaign pages is, how is this not illegal? And yeah, if it was a companion animal, it would be.
3-year-old Riley first met his Bay Area family in July.
These dogs have spent their lives in a cage. We were told directly by the people in the lab that they have never been outside.
We need to recognize at the outset that what we do to animals, from their perspective certainly, and probably from ours, is morally wrong and unacceptable. And it's really important to follow through all these exciting new leads into ways of doing research without using animals. Where is the big encouragement? Where's the political will? Where is the funding for this kind of research?
And finally, after decades of unthinkable research, the unbelievable happened.
I think there are particular concerns when those animals are close relatives of ours. And I want to point out that we have put in place a circumstance where chimpanzee research is being phased out.
Sharing over 98% of our DNA, chimpanzees were once thought to be the ideal animal model for researching human health. But billions of dollars, decades of research, and thousands of lives sacrificed yielded no cures for our diseases. In 2017, the US joined other nations in declaring the use of chimpanzees in biomedical research unjustified. Yet, as our closest living relatives are being released to sanctuary, millions more animals remain locked in labs, awaiting the next surgery, the next procedure, the next poisoning dose, while we await better treatments and cures. If the animal model was truly the gold standard for animal testing, it would not now be turning to rust. Gold does not rust. At every turn, new technologies are delivering results in faster and more effective ways than the animal model ever has or ever will. We celebrate its crumbling. Better science is ready, is waiting, to change the world of biomedical research for the animals and for ourselves.